The following program is paid for by Northern Lights Chiropractic, Watertown, New York.
What do you think of when you hear the word chiropractor? I know a lot of people immediately assume there's someone you only see when you have a sore neck or back. But that's a myth. What we're going to do is tell you the real truth behind this proven scientific healing art. You'll get a greater understanding of chiropractic healthcare and perhaps be given a new perspective for a different and better way of living. This may be the missing piece of your healthcare puzzle. Does any of this look or feel familiar?
In everyday life, we suffer pain or discomfort, but don't do anything about it. We spend thousands of dollars on our lifestyles to make them more comfortable and livable, but when our bodies suffer discomfort, we pop a pill for a quick fix and do nothing to keep it running naturally. Of course, painkillers or anti-inflammatory drugs will cover up or ease the pain and symptom, but it will do nothing for the cause.
What we want to do is show you there is a better way. So what's the big idea? Well, the big idea is your central nervous system. Your central nervous system is made up of your brain and spinal cord and is continually monitoring and coordinating every single function in your body. As you're watching this, your brain is converting nerve impulses it's receiving into pictures and sounds. It controls everything from your immune system to healing injuries to adapting to our surrounding environment. If you go out on a bright, sunny day, your pupils will constrict to control the light. Your body always tries to maintain a constant temperature, so when it gets hot, you'll start to sweat. Likewise, when things cool down, you'll get goosebumps. And of course, pain lets you know when something's not quite in harmony with your body. Did you know that chiropractic is the #1 healthcare alternative in the world and is the 3rd largest primary healthcare field? Chiropractic represents a highly scientific approach to natural healthcare, proven to be effective in thousands of research studies. Yet many people still don't understand what chiropractors do. What we're going to look at is how chiropractic started, as well as the importance of your nervous system and how it is the master controller of your everyday life, health and well-being. We'll also show you what a healthy spine looks like and how a vertebral subluxation complex can occur and interfere with your nervous system and ultimately your health. And finally, we'll give you an overview of a chiropractor's job description and education. You know what's interesting? The first recorded case of someone being adjusted by a chiropractor wasn't for a sore neck or back. It was for a hearing problem. The actual profession of chiropractic as a distinct form of healthcare dates back to 1895.
D.D. Palmer is credited as the founder of modern chiropractic. However, some of the earliest healers in the history of the world understood the relationship between health and the condition of the spine. Hippocrates, an ancient Greek doctor, advised, "Get knowledge of the spine, for this is the requisite for many diseases." D.D. Palmer had been studying anatomy and physiology for many years to learn about the vital connection between the nervous system, the spine, and one's health. On September 18, 1895, D.D. made the first recorded chiropractic adjustment on a janitor named Harvey Lillard. Mr. Lillard had been deaf for 17 years and told Dr. Palmer that while lifting something heavy, he heard a popping noise in his upper back. Shortly after, his hearing started to fade. D.D. checked Harvey's upper spine and found what he thought was some abnormal movement. He realised this might be creating some sort of nerve interference and causing the complaint. After the initial assessment when Harvey returned, Dee Dee decided to try and mobilise the area and correct the abnormal movement. The consultations continued, and after a few of what Dee Dee called chiropractic adjustments, Palmer restored the normal movement and Harvey Lillard's hearing started to return. At first, even though it proved to be a successful way of helping the body heal itself, chiropractic adjustments were not readily accepted. For many years, chiropractors were put in jail. Medical doctors claimed they were practicing medicine without a licence. Chiropractic was perceived as being in direct competition for drug companies and healthcare dollars.
Part of the plan was to discourage people from visiting a chiropractor. The Medical Society made it difficult for patients to claim health insurance and workers' compensation. They also tried to prevent chiropractors from joining hospitals and labour unions and aimed to control chiropractic schools. The scare campaign at that time proved to be an effective way of deceiving the public, but the chiropractors didn't give up.
Then, in 1976, a group of chiropractors brought charges against the American Medical Association for deliberately misleading and lying in order to destroy chiropractic, because it was seen as competition for drug companies and healthcare dollars. The legal action lasted 15 years. The court agreed with the chiropractors and called the AMA's actions lawless and unfounded. The AMA lost their case and appealed to the United States Supreme Court, who agreed with the original decision against the AMA, and they lost a second time.
But even in today's modern world, information on chiropractic care is sometimes misrepresented, misleading, or misquoted. So here are some facts about chiropractic and why it works.
You went from this to this in 9 months without any help at all. Since conception, your body has known exactly what to do. The blueprint for you and your life is there from day one. It knew what organs went where, the colour of your eyes and hair, whether you'll be a boy or girl, and millions of other things. If you think of the brain as a central computer that controls and coordinates all the functions of your body, then the nervous system is like a communication network that relays messages back and forth from the brain to different parts of the body via the spinal cord. The spinal cord is a long bundle of nerve tissue which extends from the lower part of your brain down through your spinal column. Along the way, smaller braids branch off from the cord and pass out from the spine between each of the movable vertebrae. These braids divide again and again into tiny nerve fibres and fill the entire body, going to each cell, organ and tissue. Every human has an estimated 15 billion nerve cells, sending and receiving messages through the spinal cord. Sensory nerves send messages to the brain from the eyes, ears, nose, tongue and skin. This allows us to see, hear, smell, taste and feel. Motor nerves carry messages away from the brain, and this allows us to move. So when a message comes into the brain from anywhere in the body, the brain tells the body how to react. Using pain as an example, if damage is being done to any part of the body, the brain will react with a message to tell you to stop, something is not right, or damage is being done.
Now, our nervous system is extremely delicate. So what protects it? Our spine.
This is what a normal healthy spine looks like. It has 24 movable vertebrae, each working with the one above and below it. A disc separates the vertebrae and acts like a shock absorber and a spacer for the nerve. So why is a healthy spine so important? Well, it protects the spinal cord and the delicate nerve tissue and allows us to bend, flex, twist and move freely without compromising the nerves.
Now that you've gained a greater understanding of just how important your nervous system is and how the spine's major functions are to provide movement, stability and protection for the nervous system, I'd like to ask you these 3 questions. What do you think happens if the spine is not moving freely or functioning normally? What happens if there's abnormal pressure placed on the delicate nerve tissue? And how can this affect my health? If the spine is not moving freely, it's referred to as a vertebral subluxation complex, or for short, a subluxation. Is that right? subluxation. Is there another word we can use for that? No? Okay.
This is when two or more vertebrae have lost their normal motion and or position. This can cause interruption to the normal nerve flow and interfere with the communication from the brain to the body and from the body back to the brain. Research at the University of Colorado found that it only took between 8 to 10 millimeters of mercury pressure to reduce the nerve supply by up to 60%. That's about the weight of a small coin. Compression can exist without pain, so that means where the nerve goes to can be robbed of up to 60% of its nerve supply and you may not even feel it. This is what is referred to as a silent subluxation.
Even slight pressure on the nerves can alter the quality or quantity of the messages being sent.
It can slow it down.
It can speed it up.
Or it can distort the nerve messages to and from the brain. At the tissue and cellular level, the interrupted flow is sometimes inadequate for the demands of the body. As you've just experienced, when there's a communication breakdown, it's really hard to understand the message. So what happens when you have a subluxation?
That area can start to degenerate in as little as 2 weeks. This degeneration causes scar tissue to develop, which leads to more scar tissue. This degenerative process can continue as long as the immobilization is present, and this type of degeneration is preventable.
Spinal degeneration has nothing to do with how old you are. You can be 60 years old and have a perfectly healthy spine, or you can be 10 and have a spine that's already showing signs of degeneration. It all depends on how and when the subluxation occurred. In fact, a 2003 British study using MRI showed that 9% of 10-year-olds already showed signs of asymptomatic disc changes. Previous to this study, it was thought that disc degeneration could only occur after puberty. Now let me guess, you're wondering how these subluxations can affect your health. So let's find out. Subluxations can interfere with normal communication between the brain and the body.
So for example, the nerve supply from your neck goes to the immune system, pituitary glands, sinuses, face, middle and inner ear, eyes, tonsils, teeth, neck and shoulder muscles. The nerves from your thoracic spine go to your arms, hands and fingers, heart, lungs, gallbladder, liver, stomach, pancreas, spleen, kidneys, small intestine and lymph glands. From your lower back, large intestine, appendix, abdomen, sex organs, uterus, bladder, knees, prostate, lower back and leg muscles, and that's just naming a few.
Okay, so now you know where they go. What does that mean? Well, that's a good question. If the nerve supply to anywhere in the body is disturbed, it can eventually lead to a symptom. Symptoms are the only way for your body to let you know that something's wrong. So let's go back to the same spine again.
If you have nerve interference in the cervical spine, it can lead to headaches, migraines, lowered immune system, sinus troubles, hay fever, abnormal sleep patterns, eczema, hearing loss, tonsillitis, chronic cough, croup, pins and needles into the arms and hands. In the thoracic spine, asthma, functional heart problems, bronchitis, influenza, gallbladder troubles, liver conditions, blood pressure problems, indigestion, heartburn, gastritis, lowered immunity, allergies, kidney troubles, chronic tiredness. In the lower back, constipation, menstrual problems, bedwetting, knee problems, sciatica, backache, poor circulation, swollen ankles, weakness into legs and cramping. Wow, I'm out of breath. And that's naming only a few.
Hi, I'm Dr. Becky Kashmiri. As you can see from this presentation, chiropractic is for people of all ages, whether it's a newborn baby to an elderly person that's in their 90s. So all the things that you're seeing in this presentation is very accurate with the way your body functions. So feel free to come in and get a checkup, whether you have symptoms or you don't. Because the truth of the matter is that normally by the time you feel a symptom, that condition has been in your body for many, many years. I mean, we can't feel a cancer cell. We can't feel heart disease as our arteries are clogging. I mean, even a cavity. I mean, we don't brush our teeth because we're worried that our teeth are hurting. We do it because we want to prevent disease. And that's exactly what chiropractic is about. So feel free to call the number at the bottom of your screen and come in and see us and see if this is the place for you.
Hi, my name is Ann. I started coming to Northern Lights Chiropractic over 2 years ago when I had chronic headaches, and I had no idea that chiropractic could help with headaches. But after only a few adjustments, the headaches subsided, and I also realized other benefits of chiropractic. My painful menstrual cramps subsided, and some low back pain that I had from exercising also was minimized. Before I came to Northern Lights Chiropractic, I lived with pain every day. And since then, I felt better, I've been in such a better mood, and my life is much happier because of my chiropractic adjustments.
Over 5 years ago, I suffered from a lot of different pain, and today I can say that I honestly don't suffer from any of that. And with adjustments, being pregnant, I have really improved health. I don't suffer a lot of symptoms that most pregnant women would suffer from, thanks to Dr. Tom McAuliffe's help.
My name is Vince. After deployment, I had a lot of lower back pain. I was having a lot of pain just standing for a few minutes. Could not jog, run, walking was painful. About a month or two after that, I was able to start jogging again. And here, December, January, I'm going back to sprints, which is what I like doing. So I've been suggesting to other people that have lower back problems that they should seek out care and maybe to come and visit Northern Lights.
My name is Maggie. At this point, I think if I hadn't started getting chiropractic adjustments, I would probably be in a wheelchair because I had so much pain going down my legs. And now, because I keep getting my chiropractic adjustments, I don't have as much pain. I don't have the problems where I can't sleep at night. I wake up in pain. All that is gone. I really don't know how my life would be without the chiropractic adjustments.
Basically, the doctors said that there's not a lot they can do for arthritis or fibromyalgia. I've been on medication, and I don't like the way I feel on medication. I started coming here, I started getting treatments, and I am down to hardly any medication whatsoever, and I feel so much better.
I had a construction accident. I was backed over by a bulldozer 20 years ago. Recently, I went down for 7 days, and I came to Northern Lights Chiropractic, and they adjusted me. They were very accommodating. I was walking with a cane when I come in here, and we'd have to call ahead because I'd have to lay flat. In our SUV, we put a mattress in the back of it so I could lay flat because I was not able to sit up. And after about 7 days of coming here, I was able to sit up and I could ride in the vehicle normal. And they did a very good job adjusting.
Years ago, when Steve was in the accident, they told us then that there would come a day when Steve wouldn't walk anymore. So when Steve went down for those 7 days, we thought this was the end. And so chiropractic really does work.
And I'd recommend anyone in my situation, doesn't really matter your age, I would recommend coming to Northern Lights Chiropractic.
I recommend everyone to come to Northern Lights Chiropractic. I have my whole family coming here now. It has made such a huge difference that I think everyone should come here and get care.
Incredible, completely different. I very, very rarely have headaches. If I do, it's associated with dehydration. My low back pain is so much better. I don't really experience low back pain at all anymore. There were times when I had trouble walking, and that's something that I haven't experienced in years. So immediately my headaches went away. The low back pain took a little bit longer, but within 4 months, I was able to stop taking 6 different medications. I would absolutely suggest that if anyone experiences any number of symptoms, they get checked out here at Northern Lights Chiropractic.
My name's Stacy. I've been coming to Northern Lights Chiropractic for 6 months. I had severe lower back pain, and I wasn't able to do daily living skills, and I went to the orthopedic group, and I've had care through them, and they just told me to lay down and let gravity do its thing. And my mother used to come to Northern Lights Chiropractor, and she told me about coming here, and she told me to just try it and that I would feel much better and be able to do things normally again. 4 months ago, I could hardly give my children a bath or chase them or play with them on the playground. And today I can do that. I can play hide and seek with my children. I can crawl on the floor with them. I can hide under the table. I'm able to play with my 4-year-old and my 3-year-old. Jaden has been diagnosed with unspecified asthma. Right after his first birthday, he came down with bronchitis, and he struggled for an entire year. I had talked with Dr. Tom in regards to my concerns about my son's asthma, and he had shared one of his experiences with his allergies being so bad. And he has improved a great deal in many areas.
3 years ago, I had bariatric surgery, and I had sciatica prior to that. After coming to Northern Lights Chiropractic, I noticed a big difference in my body and how I was moving. I was walking straighter, I was more upright, I was in a lot less pain. And I continue to come here because I'm a U.S. postal worker, and I find myself needing that adjustment on a weekly basis just from the work I do.
When I first came, I was using a walker. My back was so bad. Well, I've been coming often, every week, and Dr. Tom has worked on me, and I can walk straight for the first time in 10 years. I'm glad that I come here and got the help that I needed. It's taken me a long time to find somebody that could help me.
Hi, my name is Stan. I've been coming to Northern Lights for 6 years now. It come to a point where I'd wake up in the morning and I could hardly walk. I'd have to lean against the door frame for a while. I was in a lot of pain. And what brought me here was I was on a motorcycle ride with a club, just for a day, riding for about 2 hours. And when we were done, I was in so much pain. In Northern Lights, they were offering a promotional thing. So I signed up and I went through the process, and here I am. And I am so thankful because I'm able to do a lot of the activities that I couldn't do. I couldn't ride my motorcycle. I couldn't ride snowmobile without a lot of pain. And I come in, I get adjusted once a week, and I'll do decompression about 4 times a year. I'm glad that I've come, and I don't regret it one bit.
Did you know that less than 10% of your nervous system perceives pain? So quite often, by the time pain and symptoms appear, the nerve interference could have been present for months or even years. Think about when a person has a heart attack or a stroke. They don't actually feel the arteries blocking up and usually don't know anything's wrong until it's too late. Painkillers and anti-inflammatories can cover up the symptoms, but they don't get to the cause of the problem. By masking these symptoms, it allows the problem to continue to develop silently until there's a major health crisis. We all know about the damaging side effects that can occur from long-term drug use. So why continue filling your body with drugs to hide the cause of the problem? Think about all the talk about cleaning up our world's environment. Remember, our body is an environment too. The best way to fix the problem is to restore proper communication. Now you might be wondering what causes subluxations to occur. Gardening, sports, computer work, pregnancy, improper lifting, arguments, food additives, chemicals, birth, poor posture, to name but a few. There can also be mental causes, such as stress. The average 5-year-old has had approximately 2,000 falls, of which 200 are considered serious. But usually an isolated event alone is not to blame. It's an accumulation of many of life's little incidents and accidents. Recent research has found that in births that required intervention by a doctor, which means they used forceps, suction or excessive force, 95% had upper neck injuries. So it's a smart decision to have your child assessed at an early age. To become a chiropractor, it requires 5 years of full-time university study. So the average doctor of chiropractic has attended 4,485 hours of university education. On the other hand, the average medical doctor has attended approximately 4,250 hours of education, depending on specialty. A chiropractor is the only university-trained spinal and nervous system specialist specifically trained to locate and correct vertebral subluxations. So the chiropractor's job is to locate and correct spinal interference so your nervous system can perform at its own optimal level. Remember, the immobilised area will degenerate at a faster rate than the area with good balance and movement. Fortunately, with the right care and by mobilising these areas and creating good alignment, the body can begin to slow, stabilise or reverse the degenerative process. Chiropractors assist the healing process by re-establishing the nerve flow to its optimum level. This allows the proper communication between the brain and the body. Chiropractors don't treat the symptoms. Rather, they remove the nerve interference, which allows the body to do what it does best, heal itself. When you get a cut or a broken bone, who heals it? Your body does. Research shows that families involved in regular chiropractic care experience less pain, get sick less often, miss less school and work, and function at a higher level of health. In other words, they have a better quality of life. A study by a US insurance company showed that clients who used chiropractic used far fewer medical services. On average, hospital admissions were down by 60%, hospital days by 69%, outpatient procedures down by 85%, and pharmaceutical costs by 56%. That's huge. The Journal of Pediatrics found that chiropractic is the most used alternative healthcare for children. Millions of families choose chiropractic care not only for fast relief, but to achieve peak performance and a lifetime of wellness. In 1979, the New Zealand Commission of Inquiry into Chiropractic released their report. After 18 months of research, they concluded that spinal manipulation in the hands of a registered chiropractor is, quote, remarkably safe. They also commented that chiropractors are the only health practitioners who are equipped by their education and training to carry out spinal manual therapy. These days, you should have a healthcare team made up of a chiropractor, dentist, optometrist, an exercise and nutritional coach, and a medical doctor. We all know that nutrition, exercise, and a healthy state of mind are essential for your total health and well-being. You can go for days without food and water, minutes without air, but without a nerve supply, life cannot exist. Nothing happens in your body without the involvement of the whole nervous system. So we hope you now have a greater understanding of the truth behind chiropractic healthcare and the impact of subluxations on a fully functioning nervous system.
The most current research is now telling us that we will be living to 100 and beyond, whether you want to or not. How your health will be when you get there is your choice. Only 30% of your health is genetics. The rest is up to you.
All forms of the healing arts have their place, and let's face it, medicine has an important role to play in crisis and emergency care, and in these situations can be life-saving. On the other hand, chiropractic is vital in keeping your body functioning at its best possible level by removing nerve interference and allowing the body to heal itself. So for health, wellness and quality of life, chiropractic is the smart choice for you and your family.